Have you been considering whether your hospital should have a Facebook page? Or do you already have a Facebook page and have concerns about the way patients interact with you? With recent Facebook privacy issues, more questions have arisen for hospitals. Everybody seems to be jumping into the social media space. While this used to be the domain for teens, it's become the new gathering place for millions of people. Businesses have turned to this space to connect with their consumers, reporting great success. But what about hospitals? Is this the arena for them to interact with their patients? There is a twist for healthcare: HIPAA, the Health Insurance Portability and Accountability Act. Hospitals and other providers have to protect patient health information. Therefore, using social media tools such as Facebook and Twitter is more complex than for other businesses. Facebook has recently made changes to their privacy policy with little warning to users, so we'll look at how this requires hospitals to take a more well-thought-out approach to the use of social media platforms. Many hospitals encourage patients to share their stories on their Facebook wall. Marketers feel a good experience shared by another customer is very trusted by other consumers. While this is a positive marketing technique, there is concern with the amount and level of detail that some patients are voluntarily posting about their medical conditions on Facebook. Even more concerning are the actions Facebook recently took with disregard to their patients' user privacy. Users' privacy settings were reset, requiring them to opt out to protect their personal information from being shared with third parties. Defenders of these actions profess that Facebook is not responsible for user privacy, but the users themselves are responsible. They say users should know that anything posted on Facebook can and will become public, so users should not post anything that they don't want the public to see. If this is true, then healthcare organizations must reconsider using Facebook in limited ways that would not set up a follower of their page from exposing their private information. With Facebook, the user is required to find the privacy setting page and individually uncheck each of these settings. Unaware users will find that their profile information, such as interests, work, and school experiences, has been made available to third parties, and they must specify otherwise. Many Facebook users join groups of interest, such as political, health-related, or promoting a cause. They might join a diabetes association page, infertility clinic, leukemia foundation, and others. Health and life insurance companies might be able to access this information. Our neighbors, potential employers, and business associates may be able to see posts about this without the user realizing it. Users must go to their privacy settings, then specify for each type of personal information, such as birthday, religious, or political views, who can view this information. We recommend that users select custom settings and keep most information open to only me or to friends only. There are two implications for hospitals. First, your organization needs to assess if the recent changes compromise personal health information. And second, you have to educate your users as to the appropriate use of this new tool. Recommend changes to your users that they need to make to their accounts in order to protect their personal health information. Recent protests were significant enough for Facebook to immediately try to make it simpler for users to opt out. But still, Facebook chose to require users to opt out of making their information public. An additional step is required of Facebook users. They need to specify privacy settings for applications under a different page called Application Settings. Most users may be unaware they are adding new applications as they use Facebook, and they need to keep up with adjusting their privacy settings for each added application. Users who do not adjust their privacy settings will find that their interests, such as articles that they like, appear in public websites to their Facebook friends promoting that they like the page. Another key compromise to user privacy happens when Facebook users indicate that they like a page or like an article or posting, unknowingly giving page owners that they like access to personal information. Many users are unaware that this is even happening. Another change is that Facebook is pushing users to link their profiles to specific pages that Facebook picks out, based on their review of user demographics, recorded interests, education, as well as past employers. They present it as though the user cannot opt out and must choose to link their profiles. This is misleading the user and exposing their personal information. With regard to starting your own Facebook page, many staff members, medical students, and fans of the hospital start their own Facebook pages that have similar names to the hospital. People searching Facebook will have a difficult time finding the official hospital's Facebook page. How will a user know that they are conversing with an authentic hospital, doctor, or healthcare expert on a Facebook page? Redirecting customers from other pages may add to the confusion of social media navigation. Having to know a specific name other than the hospital name to get to a Facebook page adds to the confusion. For example, Brigham and Women's hospital page is titled Brigham and Women's Hospital News. There are good things to do on Facebook, such as push out videos, announce events and open houses for new technology and construction projects, poll your customers on your wall and ask for comments. Be selective as to what is posted and what your fans post about themselves and other patients. Educate your staff and physicians, providing guidance and policies that safeguard patient privacy. Having walked you through the impact on users to Facebook's recent changes, we hope you see why hospitals need to take a well-thought-out approach. An alternative to Facebook, or a way to augment Facebook, is to add a private, online community with secure sign-on. You can redirect patients to this protected online environment for discussions and health issues and obtaining trusted medical advice. That concludes our presentation on the recent privacy changes with Facebook. We invite you to visit our website or contact us to find out more about Facebook or social media usage in healthcare, or to learn about online private patient communities. We look forward to you joining our community at MyHealth Community, where your friend's privacy is kept private. Thanks for your time.